frankly, the biggest hole in the plan is us as individuals.
Yeah, it is. We're the weakest link.
Yeah, we are. We are the weak link. Welcome back to Emphasis Tech Talks, the podcast for business leaders leveraging cutting-edge technology to raise their bottom lines. I'm your host, David Clausen of Emphasis Tech. Our guest today is John Micallef, Chief Executive Officer of Oakland-Macomb OBGYN. John will reveal some interesting AI use cases and give us his thoughts on cybersecurity and hiring good people, as well as some project management pointers. This episode has a lot to unpack. Be sure to like and subscribe to make sure you get notified of future videos as they're released. Hi, John. Thanks for joining us. We appreciate you being on. Let's just get started and just fly right into it. So, being at a health organization like you are, what are some of the unique challenges faced by your organization that might be different than just the mom and pop shoe store down the road?
Yeah, I mean, it's funny. One of the biggest challenges I'd say right now is the integration between multiple healthcare systems. I mean, as you know, we all get sick at some point in our lives, and we'll go see one doctor for one thing and another doctor for another thing. They all have certain systems that they're dealing with. And there seems to be problems with those systems connecting and talking to each other. I think one of the biggest challenges is literally trying to get that information to one central point, so you can really look at the patient or the person, yourself even, from a holistic approach, and trying to determine what's going on with you as a whole instead of just a piece.
Yeah, I can imagine how that would be quite the challenge. So how big of an organization is your organization there?
So we're one of the largest, if not the largest, OBGYN practice in the country. We have several locations across the state. We also offer a pretty significant center for breast health. So we're a little bit different in organization from that perspective, where we literally serve the whole woman and take care of all their needs, from cancer screening, diagnostics, sexual health, menopause counseling, OB, GYN, pelvic floor therapy. It's a pretty wide gamut of care that we give.
And approximately about how big is your IT department? Do you have a big group or is it a small group? How do you work that?
Yeah, no. So we have several internal IT aspects. So we have people that work internal to do different sides of the business, because when you're talking about healthcare, you're looking at your normal IT, your PCs, your peripherals, your infrastructure. Well, then you've got your other side of healthcare IT, which is, similar to PACS, which is picture archiving communications. That's where you're looking at your x-rays, looking at your breast films, things like that. So those are different types of specialties. So we have multiple organizations taking care of those different aspects. And we also have some outsourced companies as well that help us with certain specialties.
Okay, good. And how are you using data specifically to improve the patient experience?
One of the things about data is it's always changing. When you're talking about healthcare, the data that you have today is not going to be the data that you have next year. So the way we look at it is, how are we going to compound that data, and how are we going to make it look chronological so we can tell you a story of your health? What's different from this point of your life compared to next year? So we try to use that data in a workflow analysis that allows us to look at it from a holistic approach. You were your X amount of pressures were this year, they're that next year, and then we take a look at those and try to give realistic predictions on what you may be facing. So data, like they say, he who has the data has the power. So when it comes to healthcare, if you have your data, you can help, drive your own healthcare. And I think it's so important nowadays that people know what's going on with their own health, just because there's so many different places to look. So it's really important to utilize that data to be able to manage your own health.
Right. Right. You made a comment there. I just want to try to capture on that a little bit. So you said about having their data. So the patient really doesn't have the data, right? Or am I missing something there?
Well, it's different today. The patient does have their data, or the patient has the access to their data. What we're allowing patients to do, and what a lot of healthcare institutions are allowing their patients to do, is to access their portal. Now, the only problem with that is what goes back to your first question, the biggest challenge. You go to get an MRI, you go get a chest X-ray somewhere. You might go to different places. There's different portals, so you have to be cognizant and aware of where that central repository of data is, because you do have access to your data. Do you control your data? No, not necessarily. I think your physician's the one that makes all the choices and explains what to do with that. But you do have access, and unfortunately, you also have access to the internet to try to interpret that data the way you might think it needs to be interpreted. So it can be a little nerve-wracking from that aspect as well. But yeah, everybody has their data nowadays, via a portal of some kind.
Yeah. Okay. Well, good. I'm glad we dove into that. I understand where you're headed with that. What is the current answer you keep bringing up about the disparate systems and the data not necessarily all being in the same place? What do you think is the answer for that? How do we fix that?
Yeah, there's $1 million question. I mean, we've been talking about this for decades, and I've been in the business for decades, and we're always talking about how do we correlate that data, and how do we get that data into a central repository? The problem is, we're a commercial industry where everybody has competition. There's lots of electronic medical record systems out there that state they do this and that they do that, and most of them do. Unfortunately, they're all just a little bit different, and they all don't talk to each other. I think a lot of it is going to come down to regulation. I think a lot of it's going to come down to patient voice and how they want to have access to their data. You've got large health systems, large hospital systems that run a particular kind of system, yet the next hospital system runs a different kind of system. I would hope that, in the future, that there would be one central repository where you're going to be able to blend those two hospital systems to be able to get all of your data. Unfortunately, it's not that way right now.
Well, it sounds like the perfect opportunity for some of the industry associations and organizations to promote a standard, right? Get a standard out there.
Yeah, David, that's absolutely correct. And trust me, they're talking about that standard now. You've got a lot of organizations like the RSNA, the radiology societies, that are standardizing data and standardizing reports so that they all are starting to look similar. You've got a lot of the OBGYN groups starting to standardize data and standardize reports and workflows and clinical pathways. Lots of specialties are standardizing their data. Problem is, they're all different specialties and they haven't come together yet. So we still need that hub to the spoke.
Well, but it sounds like at least it's headed in the right direction. I know I have seen some of that around the imagery, the radiology and so forth. So it's good to hear some of the other areas are doing that work as well. So we've got all this data. We've got it all collected. How do we use that? And I'm really thinking about AI. How does AI play into the story? And how do you see that impacting your segment of the industry there?
Yeah, AI right now it's on an exponential curve. And I truly believe that we're on that lower end of that curve. What is happening with AI is simply allowing us to make decisions faster. It's allowing us to eliminate things that probably weren't readily seen earlier in the industry. It's not going to replace people. I truly don't believe it's going to do that. I don't believe it's going to replace physicians. Nothing's going to change the human touch, and that's just too important. But it will be an excellent tool for us to use to develop those clinical pathways, to eliminate the easy, low-hanging fruits, to say that's not a cancer, or this bucket potentially is a cancer, or this bucket might really be a cancer. So it'll allow the physician to be able to look into those buckets and determine which one they need to focus on with particular urgency. Clinical pathways. How do we get from diagnosis to treatment? How do we get pharmacy, drug interactions a little bit safer? I think those tools and AI fit perfectly together. Again, it won't replace the mind. It won't replace the actual in-depth thinking and process of how things should be looked at from the human aspect, but it will allow us to move things faster. It will allow physicians to reduce fatigue, which is important in today's healthcare industry. It will decrease workload, lessen burnout, foster wellness. And I think all of that with that off our plates will allow us to even expand further.
That's what I'm seeing in some other industries is that, at least right now, using AI to allow you to focus on those areas where you need to put your attention, right? So that's what I hear there as you're talking about it, getting rid of all the noise so you can focus on exactly what you need to focus on. So,
it's really interesting in radiology, which is a big part of, of my history. It used to be we'd look at one image at a time. The physician would look at one image at a time. Well, now with AI, it looks at them as a group. It looks at them as a system. We're sharing images a lot faster. We can eliminate, like you said, the noise of thousands of images that don't need to be literally scrutinized to a particular detail. It focuses on the important ones, and allows that case to be read faster, with a little bit more detail and with more options of things to look at as well.
Interesting. Yeah. Okay. So you've got a lot of experience in the field. Obviously, you've implemented a number of different projects and so forth along the line. Can you tell our audience a little bit about maybe a project where there were some special challenges, maybe things weren't going the way that you wanted them to, and then how did you overcome that?
Yeah. So there was one particular project where we were implementing a multi-site electronic medical record system. This was earlier in the day where each individual hospital would have their own system. Well, what would happen when we started doing this project is we would implement, let's say, a Cerner or an Epic or something along those lines, where each group of hospitals, or IDNs, independent delivery networks, would come together, say, we're going to buy X amount of packages for this particular site. But unfortunately, you had legacy systems, and all about legacy systems. They have to go somewhere. So, converting those legacy systems in today's EMR packages is a nightmare in itself. Our health system that we had done that with was a 45 hospital system. And it was almost 4 years, and I ran that project. One of the biggest things, besides the human factor, because change is inevitable, but change is so difficult, especially with physicians. They're so good at what they do, but they're also stuck in their mindset. This is how they do it. This is how they want to do it. So, putting together the correct facilitation teams, I think, was important. Having a very strong project management methodology was extremely important. Developing that timeline of what needs to happen when, with sharp deadlines, accountable individuals that really made things happen across the sites, and then creating that war room or that central project management organization that helped physicians, nurses, clinicians, everybody that was really uncomfortable doing this kind of new technology. We handheld them. We try to make it as fun as possible, but it is what it is. But working together with the hospitals, working together with the executive staff, the physician champions, the nursing champions, getting that entire organization to be all on the same page was really important, especially when it came to top-down driving. I mean, it really had to be led by the executives, led by the physician champions, because if they didn't see, if the frontline staff didn't see that you were truly into this, and this was truly going to benefit the patient, benefit technology, benefit the organization moving forward, then it wouldn't have worked. But fortunately, we were able to do that.
Yeah, I have found that having a good story that explains why you're doing what you're doing and how that's going to be, benefit the organization as a whole, and will, drive everything forward. I think that's critical to those kind of implementations. So, yeah.
Yeah, the story is important. You have to literally go in there, and it's almost like you have to sell them on the story. Tell them what that story is and why do you want to do this and why it would be good. And you can't BS them and tell them it's going to be easy, because you got to also let them know this is going to be a challenge. This is going to really stress you to the limits. But at the end of the day, it benefits a lot of aspects.
Yeah, and with those types of personalities, and you're kind of alluding to it there, but setting those expectations that, like you said, if you tell them it's all going to be a bed of roses and then all of a sudden it's not, then you've lost your credibility. But if you let them know up front, okay, we know this is going to be hard, right? Let's just all say it. It's going to be hard, but it will benefit you in the long run, and here's why, yada, 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 right? Kind of thinking along in that same vein, obviously, you've had to have talented people that were, valued team members and so forth. What's kind of maybe some key tips that you can give our audience about recruiting and then keeping those highly talented folks?
Yeah, it's amazing. Like, we've all talked about the post-COVID world and everything that's changed, and it really, really has changed. The remote working aspect of things, no matter what technology you have, and I'm a big believer in technology, but no matter what technology you have, if you don't have the right individuals, the right incentive to keep those individuals, it's just not going to work. And, my organization, we're a big believer of getting the right talent. Not always waiting for a position to open and then hiring that individual. I believe in finding the right individual, and you can make a position for them, because having the right person, having the right mentality, the right technical expertise is worth its weight in gold, Dave. I mean, it really, really is. And how you drive them to challenges, how you foster that, that belief that they're doing a good job, that, not that everybody needs a pat on the back all the time, but to let them know that they are appreciated, that their technical expertise is there, that we're going to guide them along their technical journey, that we're going to help pay for education, help pay for certifications, because at the end of the day, their expertise is going to help us. So we want to make sure that they know they're valued, they're paid fairly well, and that's not the biggest driver, because you can always go and find something else. It's about satisfaction. It's about finding the right talent and keeping them, on board and wanting to stay with you.
Yeah, I think all that's great advice, John. One of the things that I've heard some pushback from some of the business owners that we work with is, they're a little hesitant sometimes to pay for that training and certification. And they've had some experiences where they do that and then, they up and leave. Yeah. So what would you say to those folks that are hesitant to spend money in dollars and energy on those efforts?
So one of the things that we've taken into account in doing that is, we don't do it right away. We want to make sure you're a fit for our organization. We want to make sure that the personality is there, the drive is there. And we also have conversations depending on what that certification is. If it's a highly technical certification that is going to cost, a decent amount of investment in you, we'd like to know that you're going to have that commitment for us as well. So we do this for you. You give us X amount of time. Those kinds of things. Or, you have to pay a certain amount back. It seems to work well, again, but you have to have the right individual that's willing to buy that kind of, incentive.
Right. Yeah. Very good. What are some other things? We talked about AI. I was just wondering if there's some other things you see coming down the pike here, either from a regulatory perspective or technical perspective. What are some other things that you're kind of seeing on the horizon that you need to adjust for and be prepared from and how does technology play a role in that?
Yeah, I think, you got a lot of big players on the block, the GEs of the world, the Philips of the world, the Siemens, all those big companies. I think the technology that they're developing nowadays is so advanced that you're going to need the training to be able to manage these kinds of advancements. It's not like the old days where you just went to, and I'm speaking for myself, you just went to x-ray school and you were able to take an x-ray on a machine. It's all software nowadays. And it's almost like you have to have some level of software expertise and able to do this. So you have to have the right individuals. And the individual today is very different than the individuals 30 years ago when I went to technical school. Because back then, a lot of it was, mechanical. A lot of it was electronics, a little different than software. And today, my son is in the same situation. He's in this field as well, in the high-tech field, in medical. And one of the reasons they brought him on board was because of the software skills that he has, not necessarily the skills of mechanics or the skills of electronics, but the skills of what he can do in software on a keyboard. So it's a different environment today than it was back in the day. So I think you're going to look and get different types of individuals applying for jobs that you wouldn't have thought they would have applied for many years ago.
Right. One of the things that I like to tell, some of the younger folks that are getting into the technical world is just kind of your point about you're not doing things the same way today as you did, back when we went to school and whatnot. So the idea that you're not going to have to learn anything else once you come out of school is just, it's a fallacy. And especially and I know there's a lot of changes in the medical field too, but I know the IT field, and I'm telling you, things change so fast. It's not even funny. I was just writing some documentation on some database systems that we work on, and it was mind-blowing to me when I went back and looked how many changes have happened over the last 5 years.
Yeah, it's incredible. It really is. Yeah.
It's just, it's really is. It's almost a full-time job just to keep up with that. So you had better be good with learning, and if you're in school and you like going to school, then hey, this is a great career field for you. If you want to learn it once and then just move on and go do it, then maybe you need to think about a different direction, different path.
Yeah, you're gonna struggle a little bit. I mean, it's true. I mean, the advancements are so fast, and it literally, even the certifications. I've got a number of certifications on myself, and I've had these for years, but the certifications today are so advanced, and so there are so many of them. That you do have a choice of the avenue you want to go down. But like you said, Dave, you have to want to learn new things because it's going to change in 9 months.
Absolutely, it will. Yep, absolutely. What other advice might you have to our audience? So keeping in mind that, these are business leaders that are looking to use technology to advance your bottom line. And so is there any kind of top 2 or 3 tips that you might give to business leaders as it comes to dealing with technology?
Yeah, I think, obviously as a CEO, I'm always concerned about finances. So I always try to look at things not only from a technological aspect and a humanistic aspect, but from a financial aspect. Obviously, I'm responsible for a lot of things. So I do like to look at options. I do like to structure agreements. It's not all one contract. It's not all one method. There's lots of ways, lots of options. So I would recommend that you work with your finance staff, work with your CFO if you're able to, if you have one, and to look at options. And it's okay to take your time. I'm a big believer in looking at the pros and cons of everything that's presented to me. I do not mind being the least educated at the table. Give me the options, I'll make the decision, but I want to know what the options are. So please have options available to you. You'll get a lot of salespeople coming in and saying, we are the best. And, maybe they are. But I just want to see what option B and C are, to be able to take a look at that and compare, because there's always that negotiation. There's always that ability to, get that little bit extra for your organization from a financial perspective. And the way you structure those agreements is so important, whether it's in terms of years or in terms of everybody's got skin in the table, or skin in the game, rather. I think it's important that you're able to look at that and determine what path or which avenue you want to go down.
Yeah, that's one of the things we've always tried to do. I tell my folks all the time that we really need to present options. So, because even though, so from the technology side, we're gonna we're gonna push for one. We know the one that we think from the technology perspective is the right answer. But there's other, as you say, there's other considerations. Uh, maybe it's for whatever it is. Maybe it's okay to take a little risk on later on having to invest more down the road because you chose option B or C right now. But depending on where you're at, I mean, they may be the right answer for you. And so we're a big fan of showing the options, laying those out there, and giving you the pros and cons, as you mentioned earlier, and letting you make a decision from there. Uh, yeah, very seldom do we want to come in and be um, fully prescriptive to just say this is what you have to do.
Yeah, absolutely correct. I think another thing I would recommend is, if I'm sure you've heard of all the security issues that healthcare institutions have been having lately with all these breaches. We have really taken a big initiative here to look at not only the technological systems that we have and what security measures are in place, but to protect ourselves. We have data that's very important, very personal. We have financial data that's important as well to run the organization. What security measures are in place? So we've contacted all of our IT vendors and all of our staff here to truly do a strong security assessment. How protected are you from breaches? How protected are you from malicious software entering your system, phishing emails, spam, links of any kind of nature? So we've really taken a big push on that in the last, I'd say, 6 months, to take a deep dive into our security and making sure that we're somewhat protected. I think there's always a risk. There's always a danger. If somebody wants in bad enough, they could probably do it. But I would recommend that you just spend a little bit more time on looking at that nowadays.
Yeah, absolutely. Uh, we just did a cybersecurity discussion panel yesterday, in fact, here locally, and that was a big part of that conversation. One of the things that has that I've recently become more conscious about is the leadership role, right? So coming from an oil and gas field, safety was huge deal in oil and gas. And you know that it's big because it comes from the leadership. So I could walk in and we would be having, 6 or 8 of us would be having a meeting with the C-level, and they would stop the meeting before we had the meeting and talk about safety. That's how important it was to them. And now I'm hearing those kind of conversations about cybersecurity. I think it needs to be bumped up a little bit more, and everyone needs to talk about it more in all of these meetings, because frankly, the biggest hole in the plan is us as individuals.
Yeah, it is. We're the weakest link.
Yeah, we are. We are the weak link. So that, the social engineering aspect of that, these fake emails that they send out anymore, oh my gosh, they are so perfect. It's hard to be able to dig through that and figure out if they're legit or not. I mean, there's a couple of tricks, and we won't take up our time here now, but that part of it is the big deal. But if it's top of mind, right? So if you're talking about it in the meetings with your people, if you're talking about it on a regular basis, you continue to bring it up. They know it's important to you as a leadership. And guess what? When they get that email that just has a little suspicious thing about it, oh, maybe the email address it came from is a gmail.com address. Maybe I shouldn't, click on the links here, right? So having it top of mind is really important, and I think one of the critical aspects of cybersecurity. So, first of all, I really appreciate you taking the time with us, John. It's been great having you. Any final thoughts for our audience before we leave it, and also include any information about how folks can keep up with you and those things that you're doing?
Oh, sure. I mean, final thoughts. Be careful out there. There's a lot of things happening. Enjoy the learning. Enjoy the journey. I mean, there's so much to take advantage of. Technology is not an enemy. It really is a great tool to help us make our lives better, more productive, learn more. Don't be afraid of it. Try to embrace it. I know it's hard, but yeah, that's really it. I think it's a great thing for us to do, and it will only help us, but it won't replace us. And I really believe that.
Awesome. And follow you. Is LinkedIn a good place for them to follow you and keep up with what's going on?
Absolutely. I'm on LinkedIn. Absolutely. I'm on it all the time. So, yeah.
All right. Good deal. Well, do the same. If you have any questions to our audience here, if you have any questions about some of the things we've talked about, if there's any way that we can help you, feel free to reach out to us here at Emphasis Tech. We would love to visit with you about it. And we love helping you regardless of what your question might be. So LinkedIn's a great way to keep in touch with us. And take care. Appreciate you all joining us today.